Kia ora koutou, Porirua City Council is in there. My name's Dr. Caroline Shaw. I'm an Associate Professor at the University of Otago in Wellington. My area of interest is transport, particularly low carbon transport and health. So I'm really keen that you as a council continue to fund cycleways in your council area, and in fact even consider expanding. We know that the most effective way to get people to cycle is to put cycleways in. There's heaps of research out there showing this, both from New Zealand and heaps of international research as well. We know that cycling's got fantastic benefits for mental health and also for physical health. So cycleways have a whole bunch of benefits for councils. Some of these include reducing carbon emissions, also making cities more livable and dynamic, and so encouraging people to come and live in your particular city. A city that encourages cycling is a city that's looking towards its future. And finally, of course, bikes weigh a lot less than cars, and so once you invest in cycleways, they're much, much cheaper to maintain than roads. I've been involved in some great research actually looking at cycling in Māori communities, and this research has shown that in a community with very low cycling rates, if you improve access to bikes, people start cycling. People report that if they run out of money on the Monday and they're not getting paid till Wednesday, they know that they can take their bike and use their bike to get the places that they need to. We have other examples where people have been able to take up jobs because they've had a bike. This particular cycleway is going to allow teenagers to have the opportunity to ride safely to school. Prioritising routes which children and young people are able to cycle on is a really important thing to do. We know from research that children and young people would prefer to cycle and walk to school. By prioritising and funding this cycleway, you will be allowing these young people to take healthy, sustainable transport to school every day.
I'm Professor Michael Baker. I've been working as an epidemiologist and public health doctor for over 30 years. I'm a professor at the University of Otago in Wellington. As a progressive local authority, you're very concerned with the health of your local people, the health of the environment, its sustainability, and also the affordability of modern living. And really, cycling ticks those three boxes better than anything else I can think of. Very few other interventions are so good at dealing with those long-term health conditions of heart disease, cancer, diabetes, and degenerative diseases like arthritis. We know that our biggest environmental human hazard is air pollution in New Zealand. It causes over 3,000 premature deaths a year, puts thousands of people in hospital. And of course, a major source of air pollution is our current internal combustion engine transport. If you look globally, the cities we love that are iconic are all transitioning to cycling. As you may have read recently in Paris, cycling has overtaken car transport as the main way that people get around. So hopefully in the future it'll be Amsterdam, Paris and Porirua. Why not? Porirua is already a compact city. I'm sure most journeys could be very well accomplished on a cycle, and I think it would be transformative.
Kia ora koutou, I'm Michael Keall. I'm a Professor of Public Health at the University of Otago, Wellington. More than a decade ago, in 2011, central government provided funding for two local authorities, which were Hastings and New Plymouth, to encourage walking and cycling. We found that there was a 30% increase in walking and cycling associated with the Model Communities program. We also found that Māori increased active travel rates considerably more than non-Māori, as did households with below median income. Our cost-benefit analysis of the Model Communities program showed an 11-to-1 benefit compared to costs. It shows that these sorts of programs should be a no-brainer. Even though there is a cost involved in building the infrastructure and promoting active travel, the benefits are 11 times these costs. When we calculated the economic benefits, we monetised the health and injury improvements using well-established methods that also take into account things like loss of earnings from illness and death, and the suffering of individuals and their whānau. We also valued the carbon emissions saved by replacing some car trips with walking and cycling. One last observation is that encouraging physical activity from walking and cycling requires sustained efforts. That means that when central government policy is no longer favouring walking and cycling, local authorities such as Porirua need to step up and fill the gap to sustain the well-being of their communities. As in our analysis, this also includes economic well-being.
As a council, you'll reap the rewards of funding this cycleway. You'll reap the rewards in terms of a healthier population, in terms of children who are able to move independently, in terms of making a transformation towards a low carbon transport system and a livable, awesome city.